Here in Canada, I'm joined by Dr. Nicholas Chadi, and he is a pediatrician specializing in adolescent and addiction medicine, and he's also the nicotine spokesperson for the Canadian Pediatric Society. Thank you for joining us, Dr. Chadi.
My pleasure. Thank you for having me.
So first, I just want your take on this proposal that's being made south of the border to ban flavored e-cigarettes.
Yes, so we are seeing, as you mentioned earlier, a very, very rapid increase in rates of young people using e-cigarettes. So the idea behind this ban of flavored products is try to control and to limit the sales of products that might be attractive to young people. So myself and the Pediatric Society is very much in favor of a similar flavor ban here in Canada. We've been asking for this actually for quite some time now, and we're hoping that the momentum coming from south of the border will help us move forward with this.
In terms of the way that the use of these particular products has grown, has it been a significant rise? I remember hearing some statistics from the United States suggesting that it is a large proportion of people, almost double between 2017 to 2019. Is the problem equally concerning here in Canada?
It is. We saw a bit of a lag in terms of increases. So the increases were seen a little bit earlier in the U.S. 1 or 2 years ago. It seems like Canadians are following that same pattern. In the past year, there's been a massive entry of those smaller, niftier, high-tech e-cigarette devices, like the ones sold by Juul, for example, that look like USB flash disks. And we've seen in the past year about a 75% increase in rates of e-cigarette use among older teenagers and young adults.
By writing this letter to the health minister, to the federal health minister, are you hoping that perhaps this becomes an issue during the election? I certainly don't think there is as much of a conversation about it on this side of the border as there is in the U.S. right now.
Yes, I think this is a great opportunity to bring more awareness just on this topic. One big issue with e-cigarettes is that it's a very tough balance to keep. It's potentially an innovation that could help adults, older people who are regular smokers, use something that's less harmful. But what we're seeing is that more young people who aren't necessarily cigarette smokers are using it. So by bringing more attention to this issue, hopefully we can have a momentum to drive in more policy measures and just more awareness in general from young people and parents and families that tell us that these e-cigarettes actually are quite harmful for young people.
And when we're talking about just how harmful they are, we know, for example, that there were these reports of a mysterious illness tied to vaping in the U.S. There haven't been any specific cases reported in Canada just yet. But for those people who do choose to use this particular product, what should vaping or e-cigarette users be on the lookout for when it comes to symptoms?
Yes, so this mysterious illness that you're referring to is still something that we're trying to understand better. There are thoughts that some of the chemicals found in the liquids that come in the e-cigarettes can cause very severe lung problems that would look a lot like a pneumonia or a bad case of flu. As you mentioned, we haven't confirmed any cases here in Canada, but it's possible that we will. Some things that we would notice in young people using e-cigarettes would be, for example, shortness of breath, some cough symptoms that would come with use over a certain period of time. We do know that the nicotine contained in the vast majority of e-cigarette products can impact how the brain develops and changes. And we're just scratching the surface in terms of understanding what the chemicals found in the liquids and the aerosols that come from these products could lead to long-term.
And on that very point, in terms of long-term impacts, what is known right now about, you talked about development as one example. What else is known by physicians, perhaps, that those who are consuming these products might not know?
Well, so we do know that the nicotine found in these devices, as well as some of the chemicals, have impacts on cardiovascular health, that have impacts on how the lungs are developing or how they are healthy long term. We do think that some of these chemicals might eventually lead to increased cancer risk. We know that some of the aerosols found in these products are cancer causing long term. We just don't know how much of a risk it might be, but we do think that there is a risk. And one significant factor is that young people, especially using e-cigarettes, tend to gravitate towards other tobacco products and other drugs. We know that about a third of young e-cigarette users will use their devices to vape marijuana, and very often very high concentration and high potency marijuana. So that's definitely something that we need to be aware of.
Well, we appreciate your time and your insights today, Dr. Chadi.
Well, thank you.